Hello, I'm Gina Miranda, speech language pathologist and neurogen. This is a continuation of the part 1 of our series Speech Sound Disorder, and in this part we are going to discuss about the strategies to treat speech sound disorders. So coming to the strategies of speech sound disorder, the first strategy would be oromotor exercises. So the goal of the oromotor exercise is to strengthen the oral musculature and improve the rate and range of motion. So the first exercise would be for the lip. We have to protrude our lip and retract our lip. We can do for the lips is the pa movement. Second exercise of the lips will be to strengthen. So take a tongue depressor, or you can also use an ice cream stick or even your thumb. Okay, ma'am, can you please protrude your lips? You have to apply slight pressure. Okay, now the individual has to push the tongue depressor by themselves. The patient has to stick their tongue out. First exercise. Second would be moving it upwards. Third would be moving it downwards, and then upwards and downwards alternatively. And fourth will be moving it towards the left and then moving it towards the right, and again alternatively. Okay. So similarly, like we did for the lips, we need to do the same for the tongue. We'll use a tongue depressor, right? And we're gonna put pressure. Can you stick your tongue out? We're gonna apply a slight pressure, and now the individual has to push the tongue depressor. Okay. Same for the lateral movement. In some cases, the child will not be able to understand the instructions or might get confused. So you can use sensory triggers like honey. So you can take honey with the cotton bud, and for the elevation you can place it on top of the lip and tell the child to touch where the honey is placed. Now similarly, you can put the honey below the lip and they have to touch it via their tongue. Okay. For the lateral movement, place it beside the lip, okay, and towards the other lip. Yes. So while doing these cheek exercise, we are focusing on something called IOBP, which stands for intra-oral breath pressure. This IOBP is important for production of sound. So would you please blow your cheeks? For strengthening, we can apply slight pressure from outside. The patient has to hold it. Try to control the pressure. Okay. So the child has to hold it firmly. Okay. If the child is not able to do these exercises by themselves, so we need to do oral massage for them. So for the cheeks, you can take your fingers and you need to push the cheek upwards like this. Has to be anti-clockwise and clockwise. The second would be for the improvement of the lips. You have to make small circles around the lips, again clockwise and anti-clockwise. Next exercise would be to push the lip upward and then downwards. Next would be for the jaw. Take your two fingers and drag it towards the joint. And then reverse. Similarly on the other side. The other exercise will be for the jaw. So the patient has to open their mouth and close their mouth. So this time we can apply external pressure for the strengthening. Can you open your mouth? Push upwards and the patient has to push it downwards. So we are making a resistant. So in cases where the child may have sensory issue, we can use a Z-Vibe or a V-Pen to improve the oral sensation. The same exercise has to be done with the Z-Vibe. Again, clockwise and anti-clockwise movement. On top of the lip. And dabbing the lip. So the second strategy would be trills and drills. The third strategy would be to give a tactile cue. Now this is important so that the child knows where exactly to place the articulator. For example, if the child is not able to say the sound F, we have to give the tactile cue like this. So here we are encouraging the patient to move their lips towards the upper teeth so that they can produce the F sound. At the same time, we can use a visual feedback so the child knows how exactly is the placement occurring, whether they are doing the right movement or not. So this sums up about speech sound disorder and the strategies we can use to treat speech sound disorders. I hope this video is beneficial for you. Thank you.